by Channel 4, the local station. This is Look Local.
Hello and welcome to Look Local. I'm Karen Adams. This is where we feature 3 local businesses a week, as well as tell you about special events that are going on around town. We do that by reminding you if you're looking for something to do or for someone to help, it is always better to look local. This week, we are featuring the Borland Groover Clinic. You will hear how acid reflux and GERD affects 60 million Americans. There is a new way to treat it. Borland Groover is one of only 3 clinics in the country that performs this new technique. We'll speak about that. Also, First Coast No More Homeless Pets is gearing up for a mega adoption event at the Jacksonville Fairgrounds. More than 1,000 dogs and cats will be up for adoption, and get this, they will all be under one roof. Plus, Alliance and Associates will be here to discuss critical changes in healthcare and how it relates to the Affordable Health Care Act. But we begin today with Borland Groover Clinic. Dr. Todd Sack joins us now to talk about acid reflux and GERD, as well as swallowing problems. Nearly 60 million Americans have it, and if left untreated, it can become a very dangerous situation. Welcome, doctor, to the show.
Thank you, Karen. Thanks for having us.
Love to have it. Talk about this because it really does affect so many people, especially around the holidays when we're eating and overeating, some of us.
Well, this is the holiday season, and no matter what your traditions are, it's the time when we experience heartburn, acid reflux, and difficulty swallowing. We're concerned about acid reflux for several reasons. First, the symptoms. They're unpleasant. Second, some forms of reflux can lead to precancerous changes, something called Barrett esophagus, that we'll talk about in a few minutes. And third, there are new forms of diseases of the esophagus that have just been come to be understood in the last couple of years, and we'll talk about one of those today. Okay,
let's talk first about the Muse procedure, because this is a special technique that is done. The acronym is M-U-S-E, hence Muse technique. And explain what we're about to see, because this is actually the surgery to fix the problem.
Well, Muse is a technique that's non-invasive or minimally invasive. A patient is asleep for the procedure for about 30 minutes. A camera goes in the mouth and down into the esophagus. And when we reach the point where the esophagus reaches the stomach, the physician, a gastroenterologist with the Borland Groover Clinic, will put staples onto the stomach to create an artificial valve, keeping acid from coming up from the stomach into the esophagus. This valve is permanent, so reflux really goes away. Patients who've been on medications for years usually won't need medicine anymore, or can dramatically reduce the expense of medications.
You're talking about, when you speak about the medications, I guess the proton pump inhibitors?
The most commonly used, the proton pump inhibitors, medicines like omeprazole, lansoprazole, Prevacid, pantoprazole, Nexium, these sorts of medicines.
Which now are pretty much over the counter for what used to be, people needed a prescription to be able to get that.
Some are over the counter, but the patients who need Muse are people who are really quite sick with near daily heartburn, requiring prescription strength medications, and they find Muse can eliminate the need for medications in most situations with a 30-minute procedure that is quite safe and minimally invasive.
All right, let's speak about one of the new types of diseases that you guys have just become aware of, and this really causes people to have difficulty swallowing, and this is fairly new for people. Many people aren't aware of this.
Yes, for decades we've been seeing patients who had difficulty swallowing, food getting stuck, and blaming it on acid reflux. It turns out that many of these patients, and there are probably 1,000 of them in Jacksonville undiagnosed, have something called Eosinophils Esophagitis. It's a long word, but essentially it's an inflammation in the esophagus, very similar to asthma, which causes troubles in the lungs. But this is like an asthma of the esophagus, where the esophagus is inflamed and goes into spasm. It isn't treated effectively with acid reflux medications. So patients suffer thinking that the reflux approach will make them better, and they only have partial improvement. The diagnosis is made by an upper endoscopy, and it revolutionizes the person's life to make the diagnosis.
And when you have the upper endoscopy, that's the procedure where the tube goes down and they're able to see the esophagus very close and see what...
Right. This is a 3 to 5 minute procedure. The patient's asleep, and instantly the gastroenterologist can see that the person has Eosinophils Esophagitis, not acid reflux, and it changes the person's life.
And does it present differently than maybe heartburn?
Many of these patients do have heartburn, but they have the important symptom of sticking of food. And we see this in the holiday season when patients at Thanksgiving dinner or Hanukkah dinner or Christmas dinner, get food stuck and end up in the emergency room where we have to take out a piece of food as an emergency. And that is often where we make this diagnosis.
That's pretty scary. But I think it's good that you guys are at least being able to diagnose it now.
Yeah.
Mm-hmm. Any type of foods that, I guess not with the sticking of the food in that particular disease, but in general, heartburn around the holidays that we need to be aware of? I know there's certain things like peppermint and caffeine, smoking nicotine can cause problems as well.
Right. The issue is the valve at the bottom of the esophagus. We call it the lower esophageal valve. And certain foods tend to open up the valve, make it more likely that the acid will come up. And those are foods such as tomato products, garlic, onions, most predominantly, also alcohol, and the worst of those is red wine. So these are the foods we want to avoid late at night and probably use only in moderation.
You know, I guess what causes the problem with this, if left undiagnosed, is the constant of the stomach acids, which are burning, constantly going up and down the esophagus and causing the reflux or the regurgitation that over time can cause your esophagus to become cancerous.
Yes, the most rapidly increasing cancer in America is cancer of the lower esophagus. And it begins with acid reflux for years and years that develops this abnormal healing called Barrett esophagus. And so patients who've had acid reflux on a regular basis should undergo endoscopy at least once in their life to know whether they have Barrett esophagus.
And you guys are fully equipped
That's
to be
what we
able to
do.
handle this.
Yeah.
Okay. We are out of time, and we appreciate you coming in so much. Some very valuable information.
Thank you. You're very inspiring.
Well, listen, you're going to come back, right?
I'd love to, sure.
Up next, if you're in the market for a four-legged friend, you'll want to be at the mega adoption at the Jacksonville Fairgrounds. More than 1,000 dogs and cats will be up for grabs. We're going to find out more next. Plus, this Saturday, the Jacksonville Giants will take on the Miami Midnights at Veterans Memorial Arena. Tip-off is at 7:30. For more information, head to thejacksonvillegiants.com.